Congratulations on your new addition to the family.
Here are a few guidelines to make sure all goes well. Development at 4 months. At 4 months, your baby should be laughing, holding her head and chest up when on her tummy, grasping objects, and making extended cooing sounds. You can support her brain development by playing, talking, singing, and reading to your baby. Continue to give your baby time on her tummy when she is awake. Never leave your baby alone. You may notice she can now roll from stomach to back. Family planning. Remember to make time for your partner and friends. Deciding when you are going to have a baby and deciding how much time you will have between pregnancies is important for your own health and your family's health. Discuss family planning and birth control with your women's health provider. Postpartum depression. Many mothers feel tired or overwhelmed the first few weeks at home, but those feelings should get better. If you find that you are feeling down or sad a lot of the time, or that you are frequently having worries that you can't take care of the baby, please let us know so we can work with you to get help.
Sleep position. The safest place for the baby to sleep is in a crib or bassinet in your room, but not in your bed. Your baby should sleep on her back to reduce the chance of SIDS, sudden infant death syndrome. When your baby is awake, you should give your baby some time on her stomach several times a day. This helps with arm and neck strength and reduces the chances of getting a flat head in the back. Car seats. Car seats are important when you have a baby in the car. It should be facing backward in the back seat of the car. Make sure the baby is always fully strapped in while in the carrier. And remember, never leave the baby alone in the car.
Walkers. We do not recommend walkers due to the risk of falls and head injuries. Babies can fall downstairs or scoot into places where they can get injured, like the kitchen. Walkers do not help your baby learn to walk and may actually delay walking.
No shaking. Never hit or shake a baby. Parents of a newborn are often tired and stressed, especially if the baby is crying. If you're feeling frustrated, put the baby in the crib and leave the room for a few minutes to get a drink of water or take a deep breath. Once you feel calm again, you can go back to taking care of the baby. Remember, if you're feeling frustrated, it is always better to put the baby down in the crib and see if someone else at home can take care of the baby for a while. Feeding at 2 to 6 months. Breastfeeding is the best nutrition for your baby. It can help prevent infections, helps with brain development, and can reduce the risk of obesity later in life. Although breast milk is best, if you are formula feeding, remember to mix 1 scoop of formula to 2 ounces of water. Your baby should eat every 3 to 4 hours at this age. We do not recommend solid food or water until your baby is 6 months old. Iron. At this age, your baby's body is growing fast and needs more iron. Iron is an important nutrient, and having low iron, also known as anemia, can potentially affect your child's development. If you are only breastfeeding, this is great, but your breast milk is a bit low in iron.
We recommend you give your baby a daily multivitamin with iron, such as Polyvisol with iron. Polyvisol with iron has both iron and vitamin D. So if you have been giving your baby a supplement with only vitamin D, you can stop giving that one now.
Teething and choking risks. Your baby may also be teething at this age. You can massage his gums with a washcloth or a clean finger. You can also provide cold teething rings. Never put your baby in a crib with a bottle, and do not prop bottles when feeding. Keep small toys and plastic bags away from your baby to prevent the risk of choking.
Sleep routine. Having a consistent nap or play routine can help your baby have a stronger sense of security. When it is time to sleep, lay your baby down while awake but drowsy. If your child is crying a little, it's okay to allow them to soothe themselves and fall asleep on their own. This will help avoid sleep problems. Fever at 4 months. After 3 months old, if your baby gets a rectal temperature of 102.2 degrees Fahrenheit or greater, she needs to be seen. It is okay to give your baby Tylenol, also called acetaminophen, but it is best to seek medical care first. And do not give your baby Motrin or Advil, also called ibuprofen, until they are at least 6 months old.
We hope this helps. Remember, every child is an individual and develops at his or her own rate. There is a range of normal in developmental stages.
If you have any questions, please ask your healthcare provider. And once again, congratulations on your new family member.